This conference will now be recorded.
All right. So hi again, everyone. I'm Emily Flynn. I'm the Director of Health and Wellness for the City of Kingston. And this is the Live Well Kingston Commission meeting on October 21st, 2020. And we're going to start with a round of introductions in just a moment. But I do not have the official language that I'm supposed to have in front of me, but it does say things like I have the right to eject anyone that's inappropriate during this meeting. Please try to mute yourself when you're not talking. What are the other important ones? Anybody remember the other important ones? I think those are the big ones.
I think one person speaking at a time is another thing we do.
Definitely good Zoom etiquette, right? All right, so let's do a round of introductions. I'm going to start with the people who are on video first, and then I can talk us through the ones that are kind of calling in. I see Minerva joining us. Hi, Minerva. Cindy, how about yourself? Would you like to introduce yourself?
Sure. Hi, I'm Cindy Muro, and I am here today on behalf of the Grow Well aspect of the group that is looking to be, skinning our way into the organization. It's kind of funny, I'll just say real quick that I retired from my job in 2017 and was sort of looking for like a right place for me to fit in my retirement. And I went to a bunch of Eat Well meetings and a Live Well meeting, and was sort of still looking for my niche. And so I'm coming to you today kind of excited that I found it. So I'm here on behalf of the Grow Well group.
I feel like that's something we should celebrate. Thank you, Cindy. Thanks for sharing. Do you want to pass it? You're muted. Do you want me to pass for you? Teresa, how about you? Would you like to go next?
Sure. I am Teresa Widman, and I wear many hats, but today that the one I'm wearing right now for today is as the focus team chair for the Heal Well group. And so I am presenting. I don't remember the last time I presented here, but I do recall that we were getting some information about burning wood and the environmental hazards associated with that. And I have been feeling guilt for several weeks, chopping all the wood, preparing for the winter, but I was still very appreciative of that talk. So thank you.
That was a long time ago. Thank you, or it feels emotionally like a long time ago. Thank you, Teresa. Troy Ellen, would you like to go next?
Hello, everybody. I'm Troy Ellen Dixon. I'm Marketing and Program Director at the African Roots Center. I also, have been actively involved in the Kingston Emergency Food Collaborative since, 10 years. And I'm very happy to be joining the commission and learning, and at some point starting to contribute.
Jerry, how about you? Would you like to go next?
Hi, I'm Jerry Harrington. I'm with Health Alliance Hospital. I'm in the marketing department, and I'm finishing my term at the end of December. Oh, and I will now pass it to Janet, who is, there you go. Okay, Janet.
Hi, I'm Janet Strominger. I am the NYSNA, the New York State Nurses Association rep that is working with the nurses at Health Alliance Hospital.
Thank you, Janet. Minerva,
and I will pass it. I will pass it to Rebecca Fox-Sevchuk.
Hi, I'm Rebecca Fox-Sevchuk. I'm sorry, I'm not on video. I have 3 kids at home. But I am a nurse at Health Alliance. I formerly worked in mental health before they closed. I currently work in med-surg.
Thank you so much, Rebecca. Minerva, would you like to go next?
Hi, everyone. Good afternoon. Also, buenas tardes. My name is Minerva Soya, and I am the Director of Cultural Affairs for the New York State Nurses Association, but it is under the Political Community Organizing Department. So I work together with Janet and with Michael, and I'm doing a lot of work with the community and different organizations to fight to get our mental health and detox services back here in our community in Kingston. Thank you.
Thank you, Minerva. Rennie, I think you're maybe on a phone call or not available, but if you are, would you like to introduce yourself?
I'm not on the phone call yet, but I have to make it soon. So I'm just lurking. Thanks for inviting me here today. I'm really interested in the question of mental health, particularly as it relates to safety in general in the community. You know, we've had a lot of discussions about the idea of police defunding. And I think one of the crucial things is to really recognize what the limitations are on what police can do. They're just not trained to take care of mental health issues. And I think that particularly with the hospital no longer having, mental health services, those getting moved over to Poughkeepsie, this is a really dangerous moment. And so I'm glad that you're putting some attention to this issue. That's why I'm here to hear what you got to say.
Thanks, Rennie. And I don't know if you said it, but you're a Common Council member, alderman for the city of Kingston.
Oh, right, yes.
Let's see. Stacy, are you there? Would you like to introduce yourself?
Yes, hello, Stacy Kraft with the Ulster County Department of Health and Mental Health. Hi, everyone.
Thanks, Stacy. Deborah, did you introduce yourself yet? Deborah Stewart, are you there? I see your name. I don't think you went yet, did you? All right, I'm going to move on to Melinda, but Deborah, if you're there, feel free to introduce yourself in a moment. Melinda, would you like to introduce yourself?
Sure, I'm Melinda Herzog. I'm the Healthy Communities Program Leader at Cornell Cooperative Extension. I oversee our nutrition, parenting, health, and community.
Oh, is it just me or did she get cut off there?
She's muted.
Melinda, do you want to try again?
Sure. Can you hear me now?
I can.
So I'm Melinda Herzog. I'm the Healthy Communities Program Leader at Cornell Cooperative Extension. I oversee our nutrition, parenting, and health and community development programs.
Thanks, Melinda. Michael, would you like to introduce yourself? Michael Hertz.
Good afternoon, everybody. Sorry for being late. My name is Mike Hertz. I'm the Area Director for New York State Nurses Association. Thank you.
Thank you, Michael. So someone correct me if I'm wrong, but I don't think Deborah introduced herself, correct? I'm trying to do a few different things at once, so feel free to give me a little bit of breathing room there. Deborah, would you like to try? All right, if you'd like to introduce yourself at another time during the meeting, feel free.
Okay, Deborah is a registered nurse from Health Alliance Hudson Valley. She works at the in the Bridgeback program for outpatient mental health.
All right, thank you so much, Janet. That's great. So we have a full agenda. I know that the inpatient mental health is going to be a big topic tonight. I think we have a bunch of different things we want to say about that, but I have it a little bit down on the agenda. So I want to get through our Heal Well focus team and our Grow Well first, and then we can talk about some mental health stuff. So I've invited, or Teresa is always welcome to come to the commission meeting to report on Heal Well. There's been a lot of activity there. Teresa, are you ready to talk about it, or should I share my screen for the focus team report? How would you like to go forward?
If you want to share your screen, that's fine. I don't know if anyone's had a chance to review it. You know, I would say that the document hasn't changed drastically. We've had, of course, as everyone is aware, a very unusual year, but I think Healwell met almost pretty regularly. I think maybe, did we skip one meeting? In the beginning, I don't recall, but we have been meeting regularly, and attendance has been pretty good. Largely in the beginning, you know, in the beginning of the year, we were sort of reassessing of what our goals were for the year. And last year we had focused a lot on trauma awareness. We had participated and collaborated in programming around trauma, probably most closely with the Institute for Family Health and screenings of the film Resilience. And so the beginning of this year, we started out with reassessing where we're at, if we wanted to continue some of that work, and then COVID arrived. And so we kind of became a support group for one another, sharing how everyone was navigating it. A lot of the members do work at healthcare facilities, and so people were sharing what they were experiencing and also resources that were available to the community that we could pass on. And then we, you know, as the, I guess, activity started to open up more, we kind of dove back into doing a little bit more work, but it hasn't, I would say we had on our agenda to kind of revisit a survey that we completed, that members had completed last year. But we aren't diving too deeply into a formal plan. I guess that would be my perspective of it. We're kind of doing things as they are coming up for us. And Emily has organized speakers at some of the more recent meetings to deal with some of the more, I guess, the issues that are tangentially related to overall.
I'm sorry, Teresa, we're having trouble. I'm having trouble hearing you. Deborah, I'm going to mute you if that's all right. Just give a hand, a signal of some kind if you want to unmute you. I'm sorry, Teresa, go on.
No, that's fine. Thank you. So so recently we started engaging some of the community members to come to speak to the group to provide a little bit more education on issues that are related to housing. We've had the conversation around mental health and what's been going on with access in Ulster County. We will be talking to the Kingston Land Trust. So kind of tangentially, but definitely related to health, members, organizations of the community who are kind of presenting to us so that we can just broaden our scope and potentially through that broaden who's involved in the Healwell meetings. We also did organize 2 outdoor healing events as a way of trying to just kind of provide something nice for the community to participate in. So various healers from the community gathered in Academy Green Park, and we did 2 outdoor healing events. I think Minerva was able to join us for one of them. And so that's kind of what we've been up to. And my guess is that we will kind of finish out the year really just kind of closing out any business that we have, probably revisiting the survey and preparing at least mentally a little bit for what we might want to do in the following year, knowing that some of it is up in the air just because of the uncertainty around the virus. And so I don't know if I should go through this document. I know you have a lot on your agenda today. And so I guess maybe if anyone has specific questions or comments, the document that Emily is sharing is our action plan that is pretty much the same as it has been, with the addition of some of the work that I just mentioned that we started really in the past few months.
Any questions around it? I had the thought, Teresa, when I was going through this recently, that we might want to tweak our goals for next year, but I wanted to keep the goals that we had set out at the beginning of the year and just at least show what we wanted to continue with and what wasn't working. But if anyone has any questions, we can try to dive deeper into that.
Yeah, I mean, from my perspective, the Heal Well team, the focus group has, you know, we kind of like set aside normal business to deal with some of the emergencies that have been coming up. And now that we kind of have a handle on everything, we'll get back into the more formalities of what our goals are and what we want to do. And certainly if this team has any input that they want us to take back to the focus team, anything that you'd like to see, any comments, concerns, obviously we are all ears.
You know, last year, I feel like one of our main goals was to build the focus team. And I feel like we've been quite successful with that. We have quite a robust attendance every month. So I feel like that's a huge accomplishment. We have other focus teams that are still kind of struggling with attendance. So now I think we can start in the evolution of a group. You know, we've kind of solidified some of the group, and now we can kind of move forward with some real actionable items, I think, in the next year. So I'm excited about that. All right, I think we're not hearing any questions. And of course, they can always, if any questions come to mind later, you can always reach out to me and Teresa. We're happy to dive deeper.
Thanks everyone.
All right, so let me unshare this. Bear with me. Sorry, everybody. Oh. Let's see. You guys, can you all see, are you still seeing the screen or is it back now?
Seeing pictures of people.
Okay, great. Okay.
Yep, no screen.
All right. Sometimes, you know, technology. Sometimes I feel like I have a handle on it, and other times all of a sudden everything disappears, and I'm like, I don't know what just happened. Okay, so let's move on. So next up is a discussion. I put it under old business because Cindy has joined us previously to introduce the concept of a new focus team called Grow Well. I sent out to the commissioners links to the mission, vision, values document, to the goals and subgroups. But Cindy is here, I think, and forgive me and let me know if this is not the question, but I think the question from Cindy is what the next steps would be if the commission wanted the Grow Well to be a focus team. But Cindy, what would you like to say on the topic right now?
Hi everybody. So yes, I'm present today just to sort of put it out there. I volunteered to be the point person for the group that we're interested in becoming a part of the Live Well umbrella, and there's quite a diverse bunch of different groups involved, which we started having conversations last April or May. When the COVID happened. And I mean, just a few of them are the Land Trust, the Farm Hub, the Novo Foundation, the YMCA Farm Project, people who had sort of started up the original Urban Ag Group, the Hudson Valley Seed Bank, and probably a lot more that I'm not remembering. So we're interested in supporting Kingston in increasing food accessibility through growing food all around Kingston in as many ways as possible. And we started this summer by doing the garden bed project, which I think we ended up distributing about almost 30 4x8 garden beds to people with soil and fencing and plants to get people started. And I do believe they're planning to continue that next early spring. So, you know, we just were looking for a structure to sort of be under and thought that maybe Grow Well would be a good place for us to be. And so, you know, as far as that goes, then it's really just, you know, whatever the Live Well, you know, group needs from us to have that sort of gel. That's what we need to know. Any other questions that anybody has, I'm happy to answer, but beyond that, I'm just making it up as I go along.
And I see that Malia has joined us, so that does make a quorum for us for tonight. So I think our question to the commissioners is, and Malia, I know you need to hop on and off, so not to put you on the spot, but just want to recognize that you're here. And I think my question to the commissioners is, you know, maybe a discussion about, do we want the urban ag group to be Grow Well? So let's start there. Melinda, Jerry, Troy Ellen, Malia, anybody want to chime in? Stacy?
Well, this is Jerry. I think that it's a great idea. I was looking at the documents, and you know, my sense is that they will become maybe more of a better reflection of what Grow Well would be over time. So I don't know if we should really consider them like formal documents yet, because I think that they will, you know, as we sort of walk into it and try it on a little bit, we'll have a better sense of what we want it to be. But I think it's good. My only thought is that it might have some, not that this is bad, but it might have some political ramifications. If we're talking about food insecurity or whatever, those might be considered political issues. They may not be. I mean, they're human, right, kind of things, but some people, particularly nowadays, consider many things to be political. So I just wanted to point that out, that we are, you know, there would be an advocacy group, but I would not want it to get, you know, really political in case that comes up. Over.
Can you explain that a little bit further, Jerry? What do you mean by political?
Well, I just think that, and maybe I'm overthinking this, but you know, a lot of times it could end up being, there could end up becoming some discussion about like structural racism or something like that involved with food insecurity. And so as a result, it's important to have those discussions, but I'm thinking that we shouldn't be, you know, make it a political issue, that's all. Just like with the Health Alliance, you know, the behavioral health beds, it's not political, but that could also be a political thing too.
I'm still unclear as to the possible politics around growing food, or that there's.
Maybe I shouldn't have brought it up, but it just.
May I finish?
I'm sorry.
I'm unclear about it, because to me, you know, providing access to food, growing food, providing garden beds, that is nothing but a good thing. And that this is in response to the fact that there is food insecurity that exists here and exists everywhere, obviously. I mean, that's what it is. The only way politics would be injected into it is if we intentionally bring politics into it. But I think that this is the kind of initiative that would I mean, I realize I'm new, but I've been working a lot with the Emergency Food Collaborative and learning about Kingston from that point of view. But I think that this is a very good initiative that we should embrace and cultivate, pun intended.
Hi, this
Oh.
is Stacey Kraft, and I am all for supporting it as a part of Live Well Kingston. It really does make sense because, you know, we are what we eat, and I love the idea of that benefiting, you know, the population and bringing more thoughtfulness to so much activity that's already happening around this issue. So I think it's great, but I do agree it could get political. Just from my years of experience with tobacco control, you know, there's instances where big companies want to be a part of these things, and so it's good to consider that, you know, hey, do we want Monsanto sponsoring an event that we do? I mean, I don't know that that would ever come to be, but you could, you know, potentially come to a situation where that becomes an issue. The other thing that could happen, you know, which the health department would not support, would be like big tobacco and marijuana now, and we would not want to see marijuana as a crop being promoted to, you know, youth. So that's just to be thoughtful of. Thank you.
And if I
So
can
this
just,
is Melinda, and this is Melinda, and I also want to say that I would certainly support Grow Well, and also to just kind of lend a little credence to Jerry's concern and what Stacy had pointed out. I vaguely remember, and this would have to be checked on, but many years ago when I first started in the Creating Healthy Places project, there was some momentum in having a resolution at the city council just to support gardens. So there is a little bit of history there just to make sure that, you know, we can have gardens in the city and agriculture in the city. And of course it was supported, but nothing ever stays apolitical. So I agree with Stacy and Jerry in that, but I would fully support Grow Well as part of this commission.
Jerry, do you want to
I
respond?
can just, no, I thank you, Melinda and Stacy and Troy Ellen. I wanted to just reiterate that I support this. And second, and something else that occurred to me in terms of making passively political, is that let's say there's some land that we have supported for agricultural purposes, and then a developer says they would like to build something that maybe the city, or part of the city at least, would like to have. That could also become a political issue. So that was another thought.
Hi, this is Malia. I also support Grow Well Kingston, and I agree with Troy, understanding that things could become political, but I think when and if that happens, we can respond together and try to manage that conversation when it happens.
I see that Anna has joined us, but she may have frozen. I can't tell if she's still there or not.
I'm here.
Oh,
Can you
okay.
hear me?
I can.
Okay, good. I'm here.
Wonderful. Any thoughts that you'd like to add in, Anna, as a commissioner?
I came on kind of late, so I missed the discussion. So I'm not going to say anything at this time.
That's totally fine. Thank you. So it feels like, so we definitely have a quorum here now, also with Anna. So, and it feels like there's general support for some concerns about some political things. I guess the next question then is, it feels positive. You know, commissioners, how should we move forward? This will be the first time that we'll be adding a new focus team. I was reviewing the bylaws today. There's not much restrictions about it. It basically says the commission can make a new focus team or subcommittee at their will. Does the commission have any questions about what the process would be, or can we build the process together? Are there any things that you'd like to see before Grow Well became a focus team? Anything like that?
I'd be interested in hearing more about, I think it was Melinda who said there's some history here, and just understanding what that is and what previous efforts we might be able to revisit and build upon.
And before it becomes a focus team, you'd like to see that?
Not necessarily, I'm not saying that we need to delay, but I think we should definitely be informed by that as one of our first efforts as we try to build this.
Any thoughts on the
So
process?
I'm just going to say that prior to the Live Well Kingston Coalition becoming a commission, focus teams just emerged. I don't think there is anything in the bylaws that you have to do formally, really. In the commission, we can just say, "Hey, welcome."
I was thinking that maybe we should do a motion though, so that it's kind of official and binding. Then I feel like the commission is a little bit committed to supporting Grow Well. That's my recommendation. I'm not a commissioner, so I guess if
I'm happy to do that motion. I'm happy to create a motion saying that we would like to support the development of a Grow Well focus team, or emergence of, however it is you want to word it.
Do I hear a second? I see Troy Ellen's hand up. Thank you, Troy Ellen. All right, so I think that according to commission laws, then I think that qualifies for a vote. So this time I'm gonna say the commissioners' names and ask for it, because last time it was a little hard to document. Jerry, I see your hand up.
Excuse me.
We need to, now that we have a formal motion, don't we need to have the discussion, even though we've had some discussion? But I think according to Robert's rules, and even Bobby's rules, we need to discuss.
Discuss away.
And that's what I was about to say. Thank you.
Okay.
And then you can say, hearing no discussion.
Okay, thank you, Troy Ellen. I really appreciate that. Hearing no
well,
Jerry?
the only thought I had, I'm sorry, Malia, did you want to say something?
I'm not sure what the exact motion is. Is it we're just creating this subgroup, or do we have to decide now who the members are, or we just create this thing and then we populate it?
Right, so the other focus teams, we don't decide who the members are. It's pretty much who will ever join us. That's not, I didn't see that as part of the motion. I see the motion as kind of a support of the Grow Well group, or the Urban Ag group, to become Grow Well, and to become officially a focus team. I guess I might include in there that we would support them like we do all the other focus teams. So I would list them on our marketing materials. I would create a page on the website. I would participate in the meetings, and any other commissioners would be welcome to participate in the meetings. So I would treat it very much like we do the other focus teams. That's my vision. Correct me if anyone sees a different vision of that.
Well, this is Jerry. I support this. My only thought is I wonder if we might want to give it time to mature a little bit before it becomes a focus team. That was my only thought, that we could support it, but not make it an official focus team until it's got its legs a little more.
I thought maybe Cindy, do you have any thoughts on that? Because you and I are kind of seeing the group evolve, and it's true, they are still trying to figure things out. Do you have any thoughts about that?
I would just say because, yes, the group is finding their legs in that we are tweaking the final verbiage on our mission statement and our vision and our goals and all of that. And I would say we have a solid 8 to 16 people who are on the meetings. We're right now, I mean, we started out meeting once a week, I think. And now we're meeting every other week, and we're committed to doing that until things sort of settle in. We are working on making our different subgroups who are going to be working on different projects, and then those will, we'll break down and start working on the goals that we have. So my question is, as far as Live Well goes, you have a once a month meeting and you sort of check in on your progress of what you're doing. And so I do not know, or I can't say because I haven't been to a lot of your meetings, whether you'd rather wait a few months until we're committed to meeting every other week and hashing this out and building big goals, particularly to hit the ground running for the next growing season. So, whether we check in with you once a month or whether you want to wait until we have a few more things done, I think that would be your call, because for me, they're kind of like meetings where everybody's sort of checking in and like that. It's not entirely as much the action. And so you can say, but I mean, we're pretty solid, committed group. Also looking forward to being, the group now is like pressing to be much more inclusive of, the whole community is the next discussion we're having about our leaders. So I don't think we're about to fall apart anytime soon. And so it's up to you whether you want us checking in the meetings earlier or later in the winter.
Thank you, Cindy. I, for one, don't have an issue with going forward now. I think that I've been seeing this in the community. They went from nothing to garden beds in a fairly short period of time. So there's a certain level of commitment and just getting stuff done. They will grow, they'll evolve. We all do, and should. But I don't see, for me personally, I'm just speaking for me, I don't need proof beyond what I've already observed happening in the community as a result of their initiatives and their focus and their work to, holding off on, making a decision this evening or afternoon.
I based my question and on the documents that I read. I don't know what about the beds and all that. I don't know about those. I was just looking at the different documents that were sent to us today, and that's where I felt that it might need a little time.
Could I just ask which parts gave you pause to ponder?
Well, I'd have to re-look at them to tell you. It's not like there's a big threat, concern. I'm just looking right now at the values. It says food justice : and there's nothing after it. I just think that we might want to give it some time. That's all.
Mm-hmm.
I get your point, Jerry. I guess part of it is the fact that even though it says food justice : in my head, I know what that means. So I guess when I was reading it, I filled in the blanks. So.
And it's funny, I'm sorry, because I haven't looked at it since last week, but I thought there was so much verbiage in there that it needed to be flushed out a lot. So the fact that it just says food justice is a little surprising to me. And I think the group is, we're working through our wordsmithing, and some people are more wordsmithy than others. And so maybe people are just being cautious at this point. There was paragraphs and paragraphs last time I looked at it. So either way, it's fine.
So I want to kind of move us around. It's about 45 minutes after 4 and we go till 5:30. So I do want to do a time check. So there is a motion, I believe, on the floor to support the urban ag group to be Grow Well. And I think, we had a second and we just had some discussion. Should we do a vote or do we want to table this for another time?
I would just call the vote.
All right.
Unless anybody else has an objection.
I would like to wait.
I'm comfortable voting, but whatever.
Melinda, Anna, do you guys want to chime in? Or Malia?
I'm fine voting now. And if we do, I do want to vote right now because I have to go back to my other meeting for a few minutes.
All right, so I'm gonna call a vote, and then if it doesn't pass, then we'll pick it up the next time. So, Troy Ellen, how do you vote?
I'm in favor.
In favor. Malia, how do you vote?
I vote aye.
Thank you, Malia. Jerry, how do you vote?
Nay.
Thank you, Jerry. Melinda, how do you vote? Melinda, can you hear me?
Aye.
Thank you, Melinda. Anna, how do you vote?
Aye.
All right. So I think the motion passes.
Hi, Emily.
Stacy?
Oh,
Hi, Emily.
hi, Dr. Woodley.
Hi, I'm sorry. I came on late, so I only got part of this, so I will just abstain.
Understandable.
And
Thank you, Dr. Woodley.
I don't know, Emily, but I'm in favor.
And Stacy. Thank you, Stacy. Sorry if I missed you there. I'm not able to type it all in while I'm talking at the same time, so I'm kind of taking a rough estimate. So I will review this and do better in the notes so that it's clearly documented, but I think that the motion passes. And if I'm inaccurate, and it is being recorded, so when I review it, if I'm inaccurate, I'll be sure to make a note of that. I'm gonna move us on now, if everyone's okay with that, to inpatient mental health services, unless anyone has a last thought about that before we move on. Okay. So inpatient mental health services. So a few of the people who are guests here tonight came to our Heal Well meeting and presented to us about the inpatient mental health services that have moved from the Health Alliance Kingston site to Dutchess County. I'd like to invite, where did she go? Minerva or anyone else to speak on that. I'm going to keep it short though, if that's all right. So maybe about 10 minutes to present on your, why you're here tonight. And then I don't know if Jerry, if you or anyone else would like to talk about Health Alliance and their kind of view of what's happening. And then I have some more information to talk about on the subject. So Melinda, Minerva, would you like to take it away?
Janet, do you want me to refer to Rebecca or Michael, or you're on mute?
I see. Yeah, Rebecca, would you like to go through a little bit of the history of what happened and what's going on, or would you like Minerva to do that?
I can go through what I do have. I have been on maternity leave, as you know, for the last 3 months. You have all two experience. I worked in mental health inpatient for about 3 years prior to going over to inpatient my pregnancy. But I have quite a bit of experience in med surg with our psych patients as well, since we did have an abundance of them come over, as well as a lot of detox. I can say that for a good amount of, I was in med surg for about 6 months after they went over to Mid-Hudson before I went out on leave. And we were taking care of quite a bit of detox patients, and I was on a cardiac step-down unit. So we had a lot of cardiac patients, a lot of stroke patients, and then we were adding our detox patients and adding a lot of the mental health patients that were taking a lot longer than it should have to go over to another facility. Many of them were not going over to Mid-Hudson, which definitely would have been a shorter commute. A lot of them were going over to Westchester. There was not really any kind of thoughts into trying to keep our patients into their communities. And unfortunately, it led to a lot more stress on the patient, led to another day or two being on a med-surg unit on a one-to-one, or even without a one-to-one, with also medical providers giving medications for agitation. I mean, I've seen somebody being agitated and getting such a minute dose of medication because they just didn't know what to give. That unfortunately took a matter of 2 hours to get. So we're managing on the floor without having any kind of support, waiting for the providers to make a decision of what they were going to do. And it took 2 hours to get a minute dose of Haldol that I didn't even end up giving because it would have just agitated the patient more. It's been really unfortunate what I've seen. I've also spoken to quite a few nurses over at Mid-Hudson Regional, and they've said they haven't seen most of our patients. So where they've been going, a lot of them have been going to Westchester. So that's about what I can say.
Thank you, Rebecca. Thank you for your experiences.
So just tagging on some of the comments, of Rebecca. Again, this is regarding the elimination of the mental health and detox services from our community. So I'm also speaking out as a community person who lives in Kingston. And prior to the COVID-19 crisis, we had Health Alliance, Mary's Ave had approximately 60 beds for inpatient psychiatry services and substance abuse detox. And during the crisis, this campus was designated as a COVID-19 hospital, resulting in the inpatient psychiatry and detox rehab services being moved to the Mid-Hudson Regional Hospital in Poughkeepsie, Dutchess County. And this became a hardship for families, community, patients. The relocation of inpatient services imposes a great hardship and causes great anxiety for these patients and their families and our community. So the patients are initially being treated in the emergency room in Kingston, and then are transferred by ambulance to the other hospitals, and sometimes not landing up a Mid-Hudson Regional because there's not enough beds there, and that there is, we had a speak out last week, and one of the mental health technicians who live in the community there's a certain amount of beds. I believe it's a 15 beds that are designated for Kingston, but when our community patients go there, the beds are not there for them because they're also treating their patients in Dutchess and Poughkeepsie. So those patients land up going to either Orange Regional, Port Jervis, Valhalla, and Westchester Medical Center. So due to the lack of beds, patients are often, again, required to go to Westchester Medical Center in Valhalla, Bon Secure community, like I said, in Port Jervis. So the distance for loved ones, adding to the burden of an already stressful situation with their loved ones. So now there is a lot of community support. There's letters that have been sent to Westchester Medical Center. There's been meetings, the Ulster County Legislative News. Everyone knows that back in June, they have passed a resolution to return our services back. But don't forget that it was supposed to be on a temporary basis. And as every day, the longer they take to bring back these services, the patients and the community, and it has a tremendous impact on our community and our families here. So we know that at the time, so right, the local elected officials, everyone knows who they are. There's been plenty of news, all over on this, with our county executive, Pat Ryan, with Senator Jen Metzger, with Kevin Cahill, and our candidate, Michelle Hinchy, and many other community groups were at the Speak Out, and including the mayor. And the Speak Out was to return our services back to Kingston. And lastly, we want this. We're asking this commission if a letter could be sent to Dr. Sullivan, the MOH, and the DOH, and COMO, to bring our services back, because the last time we reported to a subcommittee, I guess, of this commission, we're still trying to figure out your umbrella, that there was talk that they wanted to decertify the inpatient beds. But just me as a community person, some years ago, and correct me if Mike, $92 million, right, was given. The funding went in to Mary Sav, but there was a condition, and Kevin Cahill speaks about this all the time. And again, because I am a community person and I'm not looking at myself that I work for the union, I'm a friend of Kevin Cahill. We meet at Hannaford's, and he's concerned, as all of us in this community. And he says, there was commitment here at Ulster County that this community would have beds, keep beds here in our community. So when they designated it to COVID, we're like, well, what happened? Time is up. And I just want to say again that people are very concerned of this issue here in our community. So, Mike, I don't know if you want to say anything. Deb, anybody else on this issue? Mike?
Yeah. From my perspective, I feel that community welfare is a political issue. We come into discussions to make decisions about community welfare, and when I think about what is happening at Health Alliance, I don't see it as a political party issue at all. I don't think that at all. I do feel that because hospitals in New York State are generally nonprofit, have certain tax exempt statuses that the community has input into what transpires there. I also feel that many hospitals in New York State receive Medicaid, Medicare funding, which is taxpayer supported, and therefore the taxpayers have input. Again, there are these political elements that are not partisan, and certainly the suicides and the overdoses are not partisan issues. They can happen to anybody, regardless of political party. But politics is about making sound community decisions. Thank you.
Thank you, Mike. Jerry, I know I didn't invite you specifically to speak on this topic, so I feel bad kind of putting you on the spot. Would you like to respond? I know you have some facts, though, possibly.
Well, I don't know what is happening, so I can't speak to that. I just know what everybody else knows. But I do just wanted to make sure that we know that what we're talking about, and we've been talking about it this way, but not always this way, is that we're only talking about the inpatient services. We talked earlier about Bridgeback, which is still available. Methadone program is still available. People talked about the emergency department providing services to people who need both behavioral mental health issues and also addiction issues. And we still do have on the Marys Avenue campus the adult and adolescent partial hospitalization programs. This is not to defend anybody or anything, but I just wanted to make clear that the hospital is still doing some stuff, but I totally understand and agree that it's not doing the inpatient stuff. I just wanted to sort of say that, because when Rennie spoke, he talked about removing mental health and behavioral and addictions, and that's not, at least as far as I know, that's not true.
Thank you for that clarification. We have a few more minutes. Would anyone else like to talk on this topic?
Yeah, I agree that there is all the outpatient services are available in Kingston, and they're actually being expanded, but there is a gap in the system in that, as Jerry said, there is the emergency department where people that are in a crisis, they go to the emergency department, but clearly, as we can see by the transfers to inpatient units, or the need to transfer the patients to inpatient units, whether they are in the hospital on potentially a med surg unit, or if they are being sent, or if the patients are being sent elsewhere, to Valhalla, Mid-Hudson Regional, Port Jervis, and that is what is lacking in this community. As Rebecca stated, the care that is being provided to the substance use or mental health, the care that is being provided on a medical surgical unit is not necessarily appropriate for these patients. So if they get the appropriate care that they need, the services they need, they do have to go to another hospital, another facility, the closest of which is Mid-Hudson Regional. And you do have to remember that the family members, and then upon discharge, a lot of these patients rely on public transportation. So where you and I may think Mid-Hudson Regional, oh, it's not so far, it's a 25-minute drive to 30-minute drive. Based on public transportation, it's an hour and a half. We've timed it. And if family members are to participate in the care and help make arrangements for the discharge of these patients, it takes a long time. Mid-Hudson Regional recently has been, even though they've expanded the number of beds down there, they're still full. So a lot of the Kingston residents, the Kingston community that comes into the health department or comes into the emergency department at Health Alliance, they are being sent to Valhalla, which is a much further commute, particularly by transportation or Port Jervis. And so when COVID hit and those units need to be closed for a potential COVID surge, I think everybody understood it. But now the Health Alliance, and under the umbrella of Westchester Medical Center, has made it clear that they would like to permanently eliminate and close these units, not to be reopened. Now, we do understand that Mary Zav campus they're doing construction on it, but the hospital has has started discussions with the state level Department of Health and Office of Mental Health and DOH to permanently close those units. And that's where we think that it is a huge disservice to the community, because the patients who come into the emergency department really need they're community members, they need to stay in the community. And that's not even talking about or touching on the fact that right now there is a long hold of these patients in the emergency department until they can find a bed for them elsewhere. So our concern and what we are trying to prevent from happening is a permanent closure of the mental health units and the substance abuse detox and rehab units. And that's where we're coming. We're asking for your support in pushing the regulatory agencies to not approve this.
Thank you, Janet. That was a nice summary of it. Thank you. I have seen a letter back from the Westchester Medical Center to Cahill and the county exec that said that they were paying for transportation back. I don't know if anyone has seen examples of that in actuality, but they are claiming that is happening. So which brings me that I was going to offer to the commission to try to support a letter writing if the commission decided that they would like to submit a letter to the State Department of Health. So I have collected from Minerva and others some content from what has already been sent to them. And then I also received that letter, which was the Westchester Medical Center's response to it. If Dr. Woodley is still on the phone, we do still have a quorum if the commissioners would like to support making a letter to the State Department of Health, or I guess a motion to discuss doing that. Maybe Robert's rules. Troy Ellen, you can feel free to educate me on that.
You can make a motion, but after you can make a motion, and after it's seconded, you have to open it up for discussion. Or you make a motion and then somebody makes a motion to amend the motion. I mean, there's a whole process, but
There has to be discussion.
But there always has to be discussion after the motion.
There always has to be discussion.
So would anyone like to make
Or the
a motion?
opportunity for discussion.
Yes.
Would anyone like to make a motion to discuss? I guess what I'm proposing is a discussion around writing a letter. We can discuss. Someone can do a different motion.
Shouldn't be the motion. The motion should be writing the letter.
Okay.
Because you don't have to move to have a conversation, essentially.
Would anyone like to make a motion?
Make a motion to vote that we support writing letters about this issue, that we have to be very specific about this issue, that what was it, we support or that we don't support? Would someone give me the language, please?
So the letter that I've got, let's see. Well, the first sentence is to express the deep concerns regarding the elimination of inpatient mental health and detox services from Kingston.
But is there a regulation currently in front of the regulatory body?
I don't know that detail. Janet, you look like you're trying to talk. Do you know?
Yeah, I don't know if there, I believe, well, the whole process is there's the hospital would submit for a certificate of need, and the certificate of need would actually be the elimination of the decertification of the inpatient mental health and substance abuse detox rehab beds from Health Alliance Hospital. So it's
Okay.
it's a
So what
need
she
for the
said,
decertification of the beds.
that we are not
And it
in
is something,
favor, we are not in favor of, that we would write letters indicating that we are not in favor of decertification of the inpatient beds at Health Alliance.
yeah, not in favor or opposed to the decertification of the beds.
Thank you.
Do I hear a second?
I'll second it.
Thank you, Dr. Woodley.
And the question here is it writing letters or writing a letter coming from the entire group?
So I was proposing to draft a letter for the commission,
Right.
and then it would be signed, I think, the Live Well Kingston Commission.
Right.
So this is Melinda. I actually believe that this would be a great opportunity for the commission to actually do some collective action in the city and support a health policy, or at least a resolution to support mental health, which really should be part of what we should be doing.
Thanks, Melinda. Any other commissioners would like to join in on the conversation?
I think that it's important because with COVID and even prior to it, mental health is one of the areas that has been growing, number one. Number two is it cuts across all races, genders, whatever. And I think that having no inpatient option in a catchment area that is as large as the one that we serve is not good community health care. So and at a time when plans are being made to do construction to improve community health, I think eliminating that is not a particularly good move.
All right, thank you, Dr. Woodley. So I think that the motion on the table is to write a letter not in favor of the decertification of the inpatient beds at Health Alliance. Let's do I guess I'm going to call a vote on that, and then we can talk a little bit about process. So Stacy, would you like to vote or abstain?
Yeah, I'm in favor.
Dr. Woodley?
I'm in favor.
Jerry, would you like to abstain?
I'm in favor of voting, yes.
We are voting.
Oh, I thought we were deciding to vote. Sorry, like we did last time, we decided to vote. I thought we were doing that again. Anyway, so I'm abstaining.
Troy Ellen,
I'm in favor.
Malia,
Do we have enough of a quorum? Because since I missed much of the discussion, I was going to abstain from this.
yeah, you can abstain. We do have a quorum.
Okay, good.
Melinda,
In favor, aye.
so 1, 2, 3, 4. So that's 4 out of 1, 2, 3, 4, 5, 6. So 4 out of 6, and the motion passes. So then my next question for you is process. So I was going to draft up a letter, and I guess my question is, I would like to be able to show it to a few of the commissioners and get your feedback on it and make sure that it's the right language. Would any commissioners like to volunteer to work with me on that? Troy Ellen, thank you. All right. Thank you, Troy Ellen. I'll appreciate your help. I'll do most of it, but I just want someone else to kind of review it for me. So thank you. All right, so that's kind of concludes, I think, our discussion of the inpatient mental health for today. We have some more commission business if the commissioners can stay on, but all of our guests, you can feel free to go. Thank you for joining us tonight.
Thank you all.
Thank you for having us on and to
Thank
participate.
you. Yes, thank you.
So sometimes it's been a little late in the day, but Troy Ellen, yeah, you want to say something?
Remember, I'm gonna have to leave in like 4 minutes, so I don't wanna, if you need a quorum.
Yeah, so the other thing that needed, yeah. So next on the agenda was the approval of the September minutes.
Which I can't vote on.
Right, you weren't a commissioner then. And then after that was a discussion about voting remotely. So
Which I can vote on.
should we talk about voting remotely then while we have Troy Ellen? We'll do it quickly. I see a head nod. All right. So I think I sent you all Jerry's proposal about voting remotely. Would you guys like to talk about that now?
I think it was thoughtful and straightforward. I mean, we're kind of making this up in a way, but I think that Jerry did a very good job of making it up.
I can share my
Well,
screen.
thank you. I live my life that way.
If anybody would like to see it, I can share my screen. If anyone has any questions about it.
No, I have it open. Oh, maybe others need to see it, sorry.
So my computer's moving slow, so actually I can't read it in this moment, but it's opening up. Here it is. So Jerry, do you want to talk to it? Do you want to explain what you're proposing here, or do we want to call a vote? What would you guys like to do?
If people want to hear more, I'm happy to talk about it. If we don't, I'm happy to have a motion that we vote on it or not vote on it, or whatever.
Well, did everybody have an opportunity to read it?
I'm not sure.
I've looked through it. Jerry, can you say a little bit more about what prompted this? Is there some kind of specific issue that the commission has experienced in the past that this is trying to fix?
Well, I don't believe it was something that we had in the past, but because of the fact that having remote meetings and sort of having this sense of separation, I didn't want people to think that this was, oh, we'll just do everything remotely. We can do phone polls, we can do all this as sort of a default way of being. I wanted us to have commitments to in-person voting. sort of like they have in the Senate and things like that. It's a requirement to be there.
I remember, because it was discussed in the meeting in which I can't vote because I was not a commission member, but it came up because I think you didn't have a quorum and you were trying to find a way that you could get commission business done outside of the meeting, for example, if you did not have a quorum, as opposed to having to wait another, 29 days. So that was also a consideration.
Okay, I'm glad you remember that. I had forgotten about that part.
So I may be misunderstanding for the purposes of this motion what remote voting actually means, because I thought it meant like right now, the votes we've just taken, to me, those are remote voting, right? Because we are, but that's not what you're talking about, right? You're talking about voting outside the auspices of a convened commission meeting.
Yes.
And
it was
I guess
actually,
it's last time,
I'm sorry,
but I'll say it
it was
again for
actually,
anyone new. Because this commission is advisory and we do not.
You're out of sync.
Sorry, is my connection? I think my connection just got tricky. So Jerry, I'm sorry if I spoke over you.
well, it actually is about making motions, not about
Sorry,
voting.
go on, Jerry. I think you're talking. Go ahead.
Can you hear me? Can you hear me okay? Okay. It actually has to do with making motions, not about the voting itself. That it would be to approve a request to approve a motion or a request to have a voting remotely. It's basically it is to to bring some order to how we vote. And like, let's say there's something going on and I say, I want to have a board vote on this. Just because I say it doesn't mean we have to have it. That we would then have 2 officers or more agree, and if the officers, but though the officer's decision about remote voting could be overruled under my motion by 2/3 of the appointed commissioners. And I said appointed commissioners to mean the total number of commissioners, whether they're present or not. Does that make sense? Is it getting more confusing?
I'm sorry, I feel like I'm being obtuse, and I know Troy Ellen has to go, so I defer to her if. But I'm actually getting more confused. So this sounds like it's not actually about voting, and it's not necessarily about just emotions, about getting something onto the agenda to make sure that it gets voted on. And then why is that specific to remote? Like, how is this different from the normal process?
Okay, Troy Ellen, goodbye, thanks. It is not simply to get something on, well, in some ways it is to get something on the agenda, but it is to get something voted on. And I forgot exactly what prompted it, to be honest. I don't remember the details. Maybe somebody would, but if let's say today, during the meeting, someone said, I think we should also have, I'm not in a good head right now to be able to explain it too well. So I would like to move that we wait until next month to talk about this, since we also have lost our quorum.
Oh, okay. So I think we do have a quorum still because we have 6 commissioners, but
Pardon me.
Why don't we can, there's no urgency on this that I see right now. And if I can give a little background, during the COVID pause, we didn't have meetings for about, I don't know, it was like 3 or 4 months in a row. Maybe it was 3 months. And or I wasn't able to have a quorum for quite a few months. So like the meeting minutes were stacking up, and there's not huge repercussions for that, but it just was hard to get much work, like official work done. So I think that's where it stemmed from. But we don't have urgency now, and thank you actually to Malia and Troy Ellen. With 2 new commissioners, we're getting quorum. So I'm less worried about this new option, but I do think it's neat to have this new option, especially if a second or third wave do happen, as some people are talking about in my other meetings. So it would be good to have this as a tool, but we don't have to do it tonight. So Jerry, I just sent that language out today. Maybe we let people review it a little bit more, and we can try to vote on it for next month.
That's fine with me.
I don't know about everybody else, so it's 5:35. I've been at work all day. I'm starting to get a little tired myself. I'm sure that you are all as well. I'm hearing let's table it. We'll bring that up another time. The other thing that I had on the agenda was the approval of the September minutes. If the other commissioners are still here that are on, we can vote on that, or we can also table that for next time.
I make a motion that we approve the minutes as written.
I second that.
Thank you. All right. So let's see, all in favor? I can either read through the list again, or we can just do, we can do collective ayes.
I have a question.
I abstain because I wasn't yet a commissioner.
Right, exactly. That was my question. Okay. So okay. Go ahead and vote. So.
Okay. So I heard, I think Stacy say aye. I think I heard Melinda say aye. Jerry, you said aye? Okay. So I believe, and Dr. Woodley, would you like to approve the September minutes? I wonder if he stepped away. So if there's only 3 people there out of 6, I don't know if it passes. Anybody have advice on that? I'm thinking it doesn't, because I think it's not more than quorum. All right, so I'm gonna say that the motion.
For the next meeting.
What's that, Melinda? Am I
just put it to the next meeting, I would say defer it.
Great. Okay, so I'm gonna move the September minutes to the next meeting. Thank you for that. The last thing that I have to tell you all is that through Bike Friendly Kingston and Travel Well, the YMCA did a lights and bells installation at the YMCA yesterday, because there's been some reports of cyclists being stopped for not having lights and bells on their bike. So I just wanted to announce that that was an event that happened yesterday. So that was my announcement. So we're in the announcements and communications. Does anyone else have any other thing that they'd like to add before we call this meeting to a close? All right, last chance to say a word at the October Live Well Kingston meeting tonight. Thank you all for coming. Hearing none, we're going to close up the meeting. Thank you all. Technology is difficult. Just want to say that it's hard. It's been hard tonight, but it's all good. It was lovely to see everybody. And I'll see you all at our next meeting. I'll send out another meeting invite and an update with the agenda about the Friday before.
Do we need a motion to adjourn or something like that? I mean, I don't know.
We don't usually do that in this meeting.
I think we need a motion to adjourn, to be honest. Yes.
All right, I so motion.
Okay.
I second the motion. All in favor? Okay.
Aye. Thank you.
Thank you, everybody.
Bye.
Good night.